Our public safety concerns tonight, the COVID surge not only impacting patients but frontline workers.
Omicron leading to ambulance delays, hundreds of officers and firefighters out sick, and new stresses on nurses and doctors. Phil Schuman looking in all of that. He's live for us tonight in Pasadena. Phil.
Well, imagine waiting in the back of an ambulance for hours because there's no place to go. I've confirmed that 52 out of the 62 hospitals that LA City Fire dispatches to are currently on diversion, closed to new patients due to a lack of bed or staffing. This as hospitals and doctors try to keep themselves and their staff healthy.
I don't want anybody to get sick on my watch.
Dr. Janice DeVolio runs a private dermatology practice. She's rescheduling less urgent patients, saying no to anyone without a mask, trying to make sure she and her staff stay healthy. So far, at least one, perhaps two more, out with COVID during this latest spike.
We're in the middle of a pandemic. What can you say? You can't, if people are sick, they're sick. I mean, it's spreading everywhere.
On a larger scale, the LA Times reports, though the hospital won't confirm, some 100 staffers out of thousands of employees out sick due to COVID here at Huntington Hospital in Pasadena. At the sprawling Cedars-Sinai Medical Center with some 16,000 employees, they won't talk specific numbers, but the hospital's chief operating officer acknowledges COVID among doctors, nurses, and staff has increased significantly.
The incidence of COVID amongst our staff really is reflective of the incidence in the community.
But Dr. Jeffrey Smith says patient care has not been impacted due to advanced planning.
Our staff has stepped up and taken on additional shifts as needed. And in addition to that, we have had anticipated this surge and did bring in a fairly large number of travelers.
But other hospitals throughout Southern California with less flexibility result, for example, in ambulances waiting for hours to unload patients, limiting their availability for the next call. Last night, the California Ambulance Association tweeted out some 36 Southern California locations where the hospital's on diversion, sending all ambulances away due to lack of staff. Jimmy Pearson is president of the California Ambulance Association.
The sad part is when there's not enough caregivers, the patients do suffer there, right? I mean, quality of care in terms of no one wants to sit, no one wants to get sick enough to have to call an ambulance and then sit on a gurney for 5 hours or 4 hours. That's not customer satisfaction. It's not patient satisfaction.
Not customer satisfaction, not patient satisfaction. This diversion is not a new phenomenon, but the number of diversions, again, hospitals closed to ambulances, is something that we're seeing because of this Omicron spike. Although if there's any good news in that, Alex and Christine, it's that hospital stays are shorter. But for now, the request is this. Only call 911 for the most serious of emergencies and be prepared to wait if you have to. Reporting live in Pasadena, I'm Phil Schuman, Fox 11 News.